You've been dispatched to a 24-year-old female who was ejected during a motor vehicle accident. She is lying 30 feet from the car. Police have cleared the scene and it is safe for you to approach, and you may begin your assessment at the patient's side.
BSI, is my scene safe?
Your scene is safe.
All right, based on dispatch information, my mechanism of injury is ejection from a motor vehicle. Is this my only patient?
This is your only patient.
Okay, right away I'm going to go ahead and request ALS intercept. And then again, based on mechanism, we're going to take full C-spine precautions with this patient. General impression, I have a 24-year-old female who's been ejected from a motor vehicle. I'm going to determine level of consciousness really quickly. Miss, can you, Miss?
Ow.
All right, my patient responds to painful stimuli. We're going to go ahead and assess ABCs. I'm going to assess my patient's airway. Is there anything in her airway?
There's nothing in her airway and she's breathing.
Okay, awesome. So her airway is patent. She's breathing. What is her respiratory rate?
Her respiratory rate is 30 breaths per minute.
30 breaths per minute. All right, I'm going to auscultate lung sounds. All right, my patient responded to palpation of that side painfully.
Patient has decreased breath sounds on the left side.
Okay, decreased breath sounds on the left side. Couple that with her respiratory rate. I'm going to go ahead and put her on high flow O2. I would do that via non-rebreather. Okay, moving on to circulation. Does my patient have a radial pulse?
She has a weak radial pulse at a rate of 130 beats per minute.
Okay, weak radial at 130 beats per minute. I would go ahead and assess for any major bleeding. As I look down at her body, do I notice any major bleeding?
Just what you see on the lower leg.
Okay, so I would go ahead and actually expose that right away to see exactly what's going on. Do I see any active bleeding right now?
It looks like bleeding is minimal.
Okay, bleeding's minimal, so I'm going to note that and I'm going to come back to it. So based on, now I'm going to assess her skin. What does your skin look like?
Her skin is pale, cool, and diaphoretic.
Okay. So based on her pulse rate and her skin presentation, I'm also going to treat for shock right now.